Hey everybody, let's do a softball foot treatment, but let's add the little softball to our treatment so that you can begin practicing with that little softball. Now this is a great preparatory technique to do if you've never used the little ball, especially that little firm ball, because that little firm ball is what's going to create the accuracy of our position point pressing. It's the only technique that we use the little firm ball on the foot with, so let's give it a try by using the little softball first. Let's start again by putting your feet side by side. Line your feet up so it looks like your feet are going straight ahead. Put your arms at your side and close your eyes. Take a nice breath in and begin to notice your footprints. Ideally, your footprints feel balanced from left to right, but if you have a little bit of autopilot inefficiency, if your body's struggling with a little bit of stability, you might find that one footprint has more of a surface area to the ground. Scan up your legs. Notice if you're clenching any muscles in your thighs or your butt cheeks. See if you can relax any unnecessary muscle tension. Draw your awareness back down your legs. Now you put your legs side by side. Notice if your legs don't feel side by side. Notice if you feel that staggered leg position. And then lift all 10 toes and notice how your body reacts and adjusts, taking the grip of the forefoot away. Take a nice breath in, and on an exhale, drop all 10 toes. Notice if your masses drift forward. Open up your eyes. So remember, if you feel the drift, we're going to help improve your nervous system's connection to your center of gravity. Let's start with the large soft ball. And again, the other ball that we're going to be using is the little soft ball. We'll use that ball as well. So you're going to start by bringing your left foot about 1.5 feet away from the ball. Bring your forefoot onto the ball. And nice and subtly, we're just going to shift our body weight back and forth. Nice, easy, gentle compression. And then I just want you to find a spot where you can feel like you have enough weight without causing any pain on the bottom of your foot. Move your joints around, help your brain figure out where your center of gravity is in relationship to the center of your foot. And then come on back up top, take your left foot, step backward, and let's go under each knuckle of your forefoot. Just one time, we'll just try to mobilize those joints. And then we're going to practice this with the little softball. And then go under your pinky knuckle. And then we'll go to the inside arch of your foot, halfway between your big toe and your heel. We'll move the ball up just a little bit behind the big toe knuckle. We'll go to the outside arch of your foot, halfway between your pinky toe and your heel. And then we'll go just in front of your heel. Awesome. Let's stay here and just do a little bit of gliding and shearing, and then we'll practice with the little softball and see if you can get more accurate in your position point pressing before we rinse. So you'll take the ball all the way to the back of your heel, and then slowly work your way back. You come back to that point just in front of your heel. Give it a little compression for shearing, pinning the skin, creating that tight little wiggling action. Compress and wait. Give the tissue a moment to adapt. And then just set that ball aside and let's get the little soft ball. And again, this is for precision. So we're going to see if we can find all of those points on the foot. So again, take your left foot, put it about 1.5 feet away from the ball, put your forefoot in front of the ball, tickle the center of your foot. See if with the lightest touch you can find in your mind, using body sense, the center of your foot. And then let your heel drop down. And we're just going to, again, shift back and forth. Now, this little softball shouldn't cause any pain. Remember, if it does, maybe sit down and practice this. You're definitely not ready to go to the large firm ball or the little firm ball. Land on the ball, move your joints around. And then come on back up top. Take your left foot, step backward, and let's go point to point. Ball of the big toe, give it a push. And then decompress. Try the second knuckle, give it a push. And decompress. See if you can find your third knuckle and give it a push. And decompress. Try to find your fourth knuckle. Give it a push. And decompress. And then the pinky knuckle. Give it a push. And then decompress. See if you can find the inside arch of your foot. Now with this one, if you let the ball kind of poke out of the side of your foot and then you just slowly tap and bring it in, see if you can really find the tendon that causes the bunion, a little sensitive spot you might find. And then bring that ball up just a little bit behind the big toe knuckle. And then go to the outside arch of your foot, halfway between the pinky toe and the heel. And again, it's not barely on the outside of your foot. It's actually sort of in between those last two toes. So it's in a little bit. And then again, give it a push. And then decompress and go just in front of your heel. And then get rid of that ball and go back to the little softball and let's rinse. Now, we could have added the little softball right after the position point pressing, which would be the way that we'll do it in another video. I'll show you how to do a full foot treatment using all of the balls, and I'm going to be using the firm ball in that one. You could go back and use that little ball. But again, just to practice using that ball, great one to do. And then the last technique is friction. Nice and light, we'll just go ahead and rub our foot with the ball. Take a nice breath in. Exhale. And then let it go. Set that ball aside. Put your feet side by side. And let's just key into what kind of changes you can sense. I really feel a lot of changes from this one. Notice if you're feeling that leg feels more integrated and rooted into the floor, as opposed to the leg that we haven't melted. You might really feel like you can sort of feel your hip, your knee, and your ankle, showing that dehydration in the joints. Open up your eyes. Let's try that all on the other side. So again, this is just more for accuracy. We'll find the ball at the center of our foot with a large softball. Nice thing about the large softball, it's very forgiving. It's big, and it's not as big as these specific points in the joints of our foot. So if you can come close using the large softball and get more accurate using the little softball, when you go to full foot treatments and you start using the little firm ball, you'll be more confident with where these points are. So again, land on the ball, move your joints around. Let your brain pick up where your center of gravity is in relationship to this part of your foot. And then come on back up top. Let's take your opposite foot, step backward, and we'll go from point to point, softening your knee, pushing that knuckle up at your forefoot, and then decompress and go to your second knuckle, give it a push, and decompress. Now remember, you don't have to take a full step. You could just lunge a little bit forward. Just make sure that you're keeping your knee soft as you push. And remember, if you look down at your foot, you shouldn't see the ball as you go over the forefoot. And then we'll go to the inside arch of the foot, 3A, halfway between your big toe and your heel. Move that ball up just a little bit higher, 3B, and give it a push. Then go to the outside arch of your foot, halfway between your pinky toe and your heel. And then go just in front of your heel. And again, let's just hydrate the bottom of the foot with our glide. Remember the secret of gliding, consistent pressure as you go back and forth under your foot. Once you get the pressure constant, you take the ball all the way to the back of your heel, and then you slowly work your way all the way back. And then once you come back to that point just in front of your heel, you tighten up the wiggle. You compress and wait, give the tissue a moment to adapt. And then get rid of that ball, and again, let's get the little soft ball. Again, to set yourself up, you put your foot about a foot away from the ball, bring your forefoot onto the ball, and go ahead and set your foot down. And again, just rock your body back and forth. See if you can find that spot right at the center of your foot. Now, if you wanted to, again, you could move your joints around. Let your brain figure out exactly where that spot is. And then come on back up again. Slide your opposite foot behind you. And here we go. We'll go ball of the big toe, lunging into it. And then decompress, get that second knuckle, give it a push. And then decompress. Go to the third knuckle, give it a push. Decompress. Go to your fourth knuckle, give it a push. Decompress. Go to your fifth knuckle, give it a push. And decompress. Go to your fifth knuckle, give it a push. And now go to the inside arch of your foot, halfway between your big toe and your heel. Remember, there's a tendon that causes that bunion, so it's not barely at the side of your foot, it's in there. Again, if you tap your foot in, see if you can really find the tendon. Then move the ball right behind the big toe knuckle, 3B. That point's related to your cervical spine, so notice if it's tender. Go to the outside arch of your foot, halfway between your pinky toe and your heel. That really is a component of the lateral line, the stabilizers of your body. And then go just in front of your heel, again, another part that's related to the rooted core. Get rid of that ball, and again, you're going to get the large soft ball, and we're going to go through rinsing again. So nice, easy, steady rinsing motion from toe to heel. Softening your knee as you step over that ball. Try to keep your pressure constant. Trying to create that spinning vortex in the fluid flow so that the movement of the fluids pass through the body. And then the last technique is friction. Nice and light. Again, we'll just rub the bottom of our foot. Breathe. Deeper breaths than normal. Maybe breathing through your nose. Really stimulate the lymphatic system. Swap sides. Same thing on the other side. One more time. And one more time on the other side. So what a great thing to do to really alleviate not only foot tension, but knee and low back tension. Really stabilizes the body. So again, put your feet side by side just like when we started. Put your arms at your side. Close your eyes and see what changes you can sense using your body sense. Notice if your footprints feel more grounded into the floor. Notice if your thighs or your butt cheeks aren't as tense or clenched as when you started, if that's what you were feeling. Or do your legs feel more side by side if they were feeling shifted or staggered from one and the other? Lift all 10 toes off the ground. Notice if your masses really shift backwards, showing that that's probably more where your upright posture is. Help your autopilot reclaim that upright posture that we're looking for. Take a nice breath in, and on an exhale, drop all 10 toes. And notice if you don't drift at all. Open up your eyes. So now that you've practiced using the little softball, in another video I'll show you how to do the full foot treatment using the little soft or the little firm ball. It's up to you, but maybe this is your chance to try the little firm ball and see if you can perfect your position point pressing. I hope you enjoyed that foot treatment. Happy melting.